The NHS breast cancer screening scandal last night became a growing fiasco, with victims calling for the resignation of the man in charge. Helplines were overwhelmed with calls within hours of opening, while warning letters to alert women they had missed checks were sent to the wrong patients. Public Health England (FE) is attempting to contact around 300,000 women who are denied screening checks they should have been offered over the last decade. But as the first warning letters arrived on Thursday, recipients included cancer sufferers who had never been excluded from the program, raising concerns about whether those who missed checks will be reached. Victims of the scandal called for the resignation of Duncan Selby, the head of Public Health England (FE), who has remained out of public view since the blunders emerged on Wednesday. Breast cancer screening scandal. Read more. They criticized the career NHS manager for being slow to apologize to women affected by the scandal, including those whose lives it may cost. Helplines set up by FE received 8,000 calls on Thursday, with cancer sufferers saying it had taken them more than an hour to get through. Meanwhile, bereaved relatives said they were told by call handlers to put a complaint in writing. The debacle has increased pressure on Mr. Selby, the head of FE, who was already facing questions about how administrative incompetence meant blunders went undetected for years. Breast cancer scandal. By numbers. Jeremy Hunt has held furious meetings with the agency chief, demanding to know how the failures took so long to be detected. As pressure mounted, Mr. Selby on Thursday night issued a statement, offering a heartfelt and unreserved apology on behalf of FE and NHS breast screening services. And legal experts warned that victims of the scandal could face a long battle to secure compensation, with many likely to die before receiving any payout. Patricia Minchin should have been offered a mammogram in 2013. She was diagnosed with breast cancer in 2015. Credit Tom Pilston for The Telegraph. Ministers have said cancer sufferers may be able to secure payment if they can prove harm was caused by delays in diagnosis. But they have failed to announce any kind of fast-track scheme which would automate compensation for those who were denied a check and went on to develop cancer. The problems began with an error made to computer programs in 2009, which meant around 450,000 women aged between 68 and 71 were not invited for mammograms. An independent inquiry is to examine how it was that FE, which took responsibility for the program in 2013, failed to detect the problems, even as screening rates fell to the lowest rates in a decade. Around 140,000 women who missed scans have since died, with estimates that up to 270 deaths were caused by the absence of checks. Health officials have now embarked on efforts to contact around 300,000 women in their 70s, but have said it could take up to a month to send all the letters out, and 6 months for those who want mammograms to undergo them. The error affected 450,000 women. Credit Rui Vieira. PA Diane Loxham, 71, from Lancaster, was diagnosed with breast cancer last year, after having a mammogram the year before, following a screening invitation. Yet she is among those who received a warning letter from FE on Thursday saying she had been affected by the blunders. The grandmother of 3 said she was left anxious and confused, and concerned about whether the failed targeting of the letters meant women who needed to be recalled were missing out. Health Secretary Jeremy Hunt makes his statement to MPs in the House of Commons on Wednesday. Credit PA. She said, "I saw the letter and was just confused. In honesty, I'm going to call them because I think this whole disgraceful error will have caused enough people anxiety and upset, but to now be sending letters to the wrong people, what is going on?" Describing the chaos as disgraceful, she called for the resignation of PHE's chief executive, saying he should have a conscience over the failings by his agency. "I think Mr. Selby should consider his position very carefully. He should resign," she said. Brian Goff and his wife Trixie. Trixie was diagnosed with stage 3 breast cancer after finding a small lump in her breast in late 2010 and died in 2015. Now, Brian has questioned if she was one of the women who could have been saved or lived longer. Cancer sufferer Helen Jarvis, 72, was among those attempting to contact PHE's helplines on Thursday, eventually getting through after an hour of trying. The retired NHS therapist, from Newport Pagnell, has recently begun treatment for cancer, after finding a lump in her breast, and has since learned she is among hundreds of thousands of women who are never offered the scan which could have saved them. And Lee Tosi, from Brighton, said he was told to send a complaint in writing when he called the helpline to ask whether his mother, who died of breast cancer in 2012, was among those affected by the failings. "All I was told by the guy was, yes, she was probably one of those women, and the phone went dead," he said. FE last night said it had twice increased capacity in order to cope with demand yesterday, and would bring in extra call handlers today. And in a statement released on Thursday night, Mr. Selby said, "On behalf of FEE and NHS breast screening services, our apology is heartfelt and unreserved. Breast cancer scandal screening at lowest in 10 years. FEE and the NHS are working round the clock to offer advice and ensure that every person affected will be offered appropriate follow-up. Arrangements have been put in place to ensure those affected can access services appropriately, and that those already in the system will not have their care disrupted." Laura Preston, from legal firm Slater Gordon, said the numbers who could seek compensation were huge. The lawyer said the new scandal could result in the biggest legal action against the NHS ever mounted. But Ms. Preston, who was deputy lead solicitor fighting for compensation for victims of rogue surgeon Ian Patterson, said that unless a bespoke scheme was set up for victims, they could be left fighting for years. "It could be absolutely massive, but something that may take a very long time depending on how pragmatic the government wants to be," she said. "The numbers we are talking about are huge. It would be a tragedy if these victims don't get some reassurance that this is going to be dealt with quickly. Without a bespoke scheme, individuals would need to try to prove that their harm was caused by the delay in diagnosis, something the solicitor said is notoriously difficult."